Kenya is among countries with a lot of funding in the HIV response, but for the longest period, HIV has been having its way on replicating to new statistics every year. HIV has been left behind, with less institutions left to talk on behalf of the children who are struggling with HIV virus in their bodies. So I traveled to Homabay County to identify why children are failing on HIV treatment. Now, statistics show that 40% of children born from mothers or parents who are HIV positive, they get treatment failure. We just want to find out. I'm in Nyagoro, Homabay County. This is Nyagoro village, and I just want to get into one of the village member who has a kid who has defaulted for treatment and again came back to treatment. Just want to find out, is it true that indeed this percentage is alarming, and is it true that some of the things that are contributing to this are happening in Homabay County, basing the fact that Homabay County is one of the counties that has a bigger number of prevalence of HIV. A recent research, which is not in the public domain, reached our investigation desk with shocking statistics on how children were failing on HIV treatment. This research focused on Homabay County. In 2020, the Nyanza Western Technical Working Group singled out Homabay County as the best county in HIV case management from a pool of 10 counties. But children are failing on HIV treatment, with the latest data showing 427 children between 0 and 14 years with HIV positive, children having treatment failure. This is Jason, not his real name. Jason's family has had a fair share of wrangles, picking him and her belongings, leaving behind his drugs.
Mama alikataa simezi dawa, sasa akatoka, tunaenda huko kwa nyanya, tunarudi, naambia nichukue dawa, anasema hapana, tuende. Na hizo nilikuwa amekataa ati simezi dawa, tuende. Na hivyo maisha yangu ilikuwa hatarini. Sasa mimi nilienda hospitali, nikasema, madaktari wakakuja wakaongea na yeye. Sasa baba wakaongea vizuri, sasa nikaanza kumeza dawa vizuri. Sasa
Jason's father explains why.
Sasa kuna wakati ambao tulikuwa tunaishi hapa na kawaida ya familia. Sasa kazi yake arudi chini, hiyo ndio shida. Unajua ukiwa kwa nyumba lazima mtu mmoja afanye akwe chini ndio mambo yaende vizuri. Sasa vile aliona naye pia kuna mwenzake hapa. Sasa hizo zote akiunganisha ana jamaa anaingilia sana. Sasa ikabidi atoroke na watoto. Huyu msichana mdogo ambaye amemsalimu hapo anaitwa Beverly, na huyu Beverly na yeye kwange kwa dawa. Sasa nitoroka wakaenda kwa kaka. Sasa akirudi, sababu watu wa facility walikuwa wanamtaka yeye Fred. Akirudi akamtoa damu, ikapatikana hizo iko juu zaidi.
As of September 2022, there are 1.2 million people living with HIV on antiretroviral therapy, among them 57,432 children between 0 and 14 years, representing 4.5%. In Homabay County, a total of 189 people living with HIV are currently accessing HIV care and treatment, of whom 6,507 are children, representing 11%, with a viral load suppression of about 93% and 88% respectively. Wakati ulikuwa umezi dawa, shida ile ulikuwa na matatizo fulani?
Kama
gani?
Kama kichwa yangu ilikuwa siwezi ona vizuri, na feel vibaya, siwezi hata kula vizuri.
The pregnant women population stands at 94%, with people living with HIV pregnant women on antiretroviral therapy at between 74% and 100. Vertical HIV transmission from mother to child, MTCT, is at 7.4%, with new HIV infections at 31% and 20%. People living with HIV pregnant women on antiretroviral therapy not being virtually suppressed. In the same village I visited Mike, not his real name, during his clinic visits for checkup, and his story almost the same as that of Jason.
Niko grade 6 hapa hospitali, yani kitambo wazazi wangu walikufa, nyanyangu akanichukua tukaenda kuishi na yeye, kisha hakuwa ananipatia dawa kwa wakati inayofaa.
Kwa nini?
Sijui hata ni kwa nini. Kisha wakanipeleka kwa orphanage yenye inaitwa Hope Center. Nilikuwa nagonjeka sana. Ndio nikapelekwa Hope Center.
Alikuwa anapewa dawa, lakini kwa sababu hakuwa anajua ni kwa nini anameza dawa na yeye mwenyewe ajisikie ni mgonjwa. Nikimuuliza akaniambia hakuwa anajisikia ni mgonjwa. Sasa hakuwa anameza dawa juu anaona tu hiyo dawa anameza tu na kuna kitu inamsaidia. Hakuwa anajua ni kwa nini anameza dawa.
Looking at Homabay County, 427 children failing on treatment. Stephen Omondi, the Homabay HIV and STI Control Coordinator, agrees that indeed treatment failure in children has been detected.
Our prevalence is about 17.2%, and the majority of the population that are ever on ARVs in Homabay County is 135,400, and so far we have around 123 HIV infected adults, and we have around 7,440 children and about adolescents of around 8,817. The prevalence for Homabay HIV is 17.2. and we have a challenge with suppression in pediatrics and children.
Stephen explains why it could be a dangerous affair for the county.
And from most of the studies that we found, that we realized that suppression is because of majority of these children of these adolescents, let's say so, are children of these children who are adolescents. So the challenge is because of stigma, she's an adolescent who wants to be in school and still wants to take care of that child. They want to keep clinic days. So there's a lot of adherence to treatment, adherence issues, and this has made our viral suppression for our children and adolescents to be not significantly achieved. Because in our last study that we did a viral load for around 3,593 children, and we realized that out of that, 427 of these children were not virologically suppressed. Apart from the total number of our children and adolescents on the ART who are around 14,000, we have around 427 who are unsuppressed.
I sat down with Dr. Rose Masaba, the lead researcher who revealed the finding to us.
So in this particular case, there was indication that children were doing worse than the adults in terms of treatment. Children who are living with HIV were doing worse than adults on ARVs. So we designed a study just to be able to define it better, to find out exactly what the extent of this was, and also to be able to identify the different factors that are leading to children not doing well on ARVs. So we designed a study to determine the rate of treatment failure, antiretroviral treatment failure, amongst people living with HIV in Homabay, in selected facilities in Homabay County. This was very scientifically done. I'm telling you, we randomized facilities, we randomized the patients. So based on that, based on the methodology that we used, these results can be generalized.
Dr. Masaba findings revealed shocking revelations in HIV response among children.
Children 0 to 14 years old were 4 to 5 times more likely to have treatment failure as compared to adults. The treatment failure rate in adults was 3.7%, while in children it was 15.2%. Then another key finding that we came up with was that the male, and this is overall, not just specific to children, the male were also more likely to fail, about 1.5 times compared to their female counterparts. Those patients who had been having some kind of side effects while they were taking the ARVs were also more likely to fail.
One of the reasons to treatment failure among children has been unfriendly drugs.
There's a lot of science, and management of HIV has been evolving and continues to evolve. So when a new drug is introduced, it's definitely introduced after studies have been done and it shows that it's better than what we had. That is the only reason we would leave what we had to go into the new drug. And this is not a new drug per se. It's a new formulation for the child. It's been introduced in adults before. So the drug exists, dolutegravir exists for adults, but there was no formulation for children. The previous one, the lowest was 50 milligrams. So when we are talking of a child who is less than 20 kg, that drug was not targeting those children. So now the pediatric DTG that has come up, the 10 milligrams, targets children who are 20 kg and below.
There is a lot of documentation on what can work. And so how best the program and the counties adapt that is very important. Because we've been able to document what works, but the children are not directly benefiting from that.
Dr. Eliud Mwangi, a pediatric HIV expert, zeroes down to caregivers being empowered as the best way to healing the menace.
Clearly, the children, as I said, or the children depend on either a parent or a guardian. And it's not, the child requires that support really to be able to adhere to the treatment, because they have to take the drugs every day. Some are going to school. So there are a lot of stakeholders that really determine the outcome of a child who is on treatment. So right at home, we need to have that guardian trained, the caregiver trained, and also be available to give the treatment. That child at school, the teachers also needs to understand and be trained and be able to ensure they are supporting that child to take their treatment. The healthcare workers, they also need to ensure that that patient level care or the patient-centered care is what is needed, so that you take the child as an individual, you understand what they are going through.
Just like Jason, who wants to be a footballer despite his HIV status, if response to children is not taken care of, then his dream of getting his family from poverty might never come true.
Mimi nataka serikali asaidie watoto ili kupatia dawa ili wakiwa wakubwa wapate ndoto zao.
Na wewe ungelipenda kuwa nani ukiwa mkubwa?
Mimi napenda kuwa daktari.
Kwa nini?
Ama footballer.
Kwa nini?
Kwa sababu footballer ukicheza hata kama nyaliana, nisema ati kuna mtu anachukua watoto anapeleka kwa timu wakubwa, Amechukua, amepeleka kwa timu kubwa. Sasa mimi nacheza huko. Sasa mama alipi pesa za shule.
Utakuwa lipa.
Hapana, kochi yetu.
Kochi yetu. So unataka ucheze ball wakuchukue uende ucheze timu kubwa. Timu yako ni gani?
Liverpool.
Unataka kuchezea Liverpool?
Kwa mkubwa.
Ningeomba tu serikali waangalie watoto, waandike wale wanaweza angalia watoto hata mpaka nyumbani, waone venye watoto wanameza dawa, alafu wapee watoto motivation. Mtoto akikuja clinic apewe angalau maziwa ama mkate. Sasa kama anakuja anajua anaenda hata aenda kukaa njaa. Wengine wanakuwa wengi, wanakaa mpaka wanasikia njaa. Saa zingine, because some of them are orphans like the ones I'm taking care of. Saa zingine other orphans cannot even get porridge in the morning. Anakuja hapa anashinda njaa. Kesho ya wakati mwingine hata apenda kuja kufanya nini? Clinic juu anajua tu huko akienda hata shinda njaa, na kirudi nyumbani apate labda wengine wamemaliza chakula.
Now, Kenya has the 5th largest number of people living with HIV globally. In 2021, 5,200 children were infected with HIV, and 3,100 children succumbed to HIV or AIDS-related illnesses. As of July this year, 427 children failed on ARV treatment in Homabay County. Now, Kenya is among those countries that have signed global health commitments. With Vision 2030, we are remaining with 8 years to go to eliminate HIV new infections by 2030. Is this vision or is this goal too ambitious? And where is the child in this? For Ebru TV, I'm Odee Francis.